Pulmonary pathology in the oncological context demands a comprehensive diagnostic approach that allows for the precise differentiation of histological subtypes of lung cancer, as this classification determines the therapeutic strategy and clinical prognosis. In particular, the distinction between small cell carcinoma and non-small cell carcinoma is fundamental, since both exhibit distinct biological behaviors and therapeutic approaches. Within non-small cell carcinoma, subtypes such as adenocarcinoma, squamous cell carcinoma, and large cell carcinoma show variations in their embryological origin, anatomical location, and molecular profile, which influences the response to targeted therapies. In this regard, obtaining adequate samples through biopsy, complemented by immunohistochemical and molecular studies, allows for the identification of specific markers and genetic alterations relevant for personalized therapeutic selection. Furthermore, the lung can be affected by iatrogenic injuries resulting from medications, radiotherapy, or intravascular devices, generating diverse histopathological patterns that include interstitial pneumonia, diffuse alveolar damage, organizing pneumonia, or progressive fibrosis. Soluble mediators such as TGF-beta, along with mutations in genes regulating cell growth, contribute to both fibrogenesis and carcinomatous transformation. Consequently, the histopathological analysis of the lung in cancer patients requires integrating therapeutic history, morphological findings, and molecular data to establish an accurate differential diagnosis and appropriately guide clinical decision-making.